So here we go. This is the 2020 ICD-10 video, kind of an intro to it. We'll go through the book, talk about some tabbing, and then I'll have a second video kind of going through the guidelines and some more specific stuff. This video will probably do a little bit of actually looking up codes in the index. This particular publisher, TCI Books, is the first time I've ever used them. They just had a good price on a bundle, so I got it, and I needed my hospital for any potential inpatient stuff that I might do. Optum has, I don't have the 2020 of this, but Optum has great versions of it. Expert, you need to make sure that you can use that on the board. But for everyday use, I love the Expert. Also, Carol Buck has a great edition or version of the ICD-10. So here we go. So we've been through the CPT, which is all of our procedures. That's our actions. Now we're going to learn the diagnosing side of things that provide the medical necessity for the actions. That's kind of how they play together. So each, depending on your publisher, your book will come with a tab section or a tab page. I just use the tabs that come with it. You could potentially use tabs like this. This is what I used to do when I didn't buy books that had page tabs. This is the, whoops, that one's messed up. These are the tabs that I use. They're very, very, very close to what these tabs are, and they're very, very user-friendly. So some of the things that I tab, if I were just getting to know this manual, I would tab the symbols, which is this section. We'll kind of go over that once I give an overview of the book. We'll go over the different symbols and how to even go about reading the book. You have an anatomical illustration section that I would tab. This actually, I've taken 3-4 AAPC boards now. This actually is vitally important for me every time I sit for a board, believe it or not, even with my nursing background. I end up putting notes in here, or there's a scenario that I have to go specifically look at the heart or specifically look at a shoulder or a face, something like that. And it will help trigger me to kind of have, if you're vacillating between two choices, for me, it helps. These are also really good places that you can put notes, maybe medical terminology that you struggle with, prefixes, suffixes that you struggle with, that kind of thing. Just helping you out with some cheats. Anything that you write in these manuals, you're good to go. You just can't put sticky notes in or something like that. It has to be actually written on the page. I personally would write as neat as possible. I would probably write as small and organized as possible so you can get more notes in. But you just kind of learn trial and error as you go. I typically do not have as many notes in my ICD-10 as I do my CPT. Picking the diagnosis for me is an easier task than picking the procedure to go with it, because sometimes those procedures are really involved. That's usually why I start the CPT before, or that's the first thing that we do in the course. We kind of get it behind us. We do what I think is a different angle through the ICD-10, and then we can bring it all back together in that advanced portion. So you have a tab for the index if you so choose. Where ICD-10 differs from your CPT manual. I told you in the CPT manual you needed to be familiar enough with each organ system that you did not have to go to the index. You only go there as a last resort, or if you're just spending a huge amount of time looking up a code, because time is usually of the essence. It certainly will be on your board. The ICD-10, opposite of that. How you are supposed to use this manual is to go to your index first, then verify the code from the index back in the tabular section. So you have an index section and you have what's called the tabular section, where all the actual codes are found in the specific codes. So how you use it is, let's just look on this very first page. Let's say the doctor has diagnosed the patient with an acute abdomen. So you go to A for abdomen. It's indented acute, so R10.0 appears to be the right code. So what I mean by verify, you would have found the diagnosis in your index, and then you will go to the R10, which is way back here, and simply verify that that's actually the code that you need. So right here is R10.0, acute abdomen, severe abdominal pain, generalized with abdominal rigidity. The parentheses are always what we call a non-essential modifier. They're just giving you hints or suggestions for wording or documentation that you may see from the doc. You don't have to have that. So your acute abdomen may be all the doctor gave you, or maybe all the doctor gave you was severe abdominal pain. Those two would still get you right here. And then you're just verifying that that would be the code that you needed. Okay, so that's extremely fast going through that. So in your index, this doesn't necessarily index like a regular book would. There's a strategy to it, and there's, of course, a twist to it because nothing in coding is just super duper easy. What I will tell you is if you look at, and it's really hard to see on mine, you can barely see it right here where I have the indented stuff. There are lines, 2 lines. Some of the publishers have darker lines so you can see it better. But they've added these lines the last several years to kind of help our eyes focus. So let's go back to the very first page. That way everybody's on the same page. So we're back to the A page. You can see your 2 lines in each column. So let's look under aberrant. So under aberrant or under acute abdomen, you have the first line leads up to the first indentation. And then that just kind of follows all the way down so that your eyes don't mistakenly see something indented as actually being at the border. Let's see where that second line comes into play. So under abnormal right here, let's go to auditory perception. So abnormal, and then indented auditory perception. And then under auditory perception, there are even more things. So there's your threshold shift, your recruitment, your hyperacusis. So that's just further specifying or specifically describing what your specific issue is. So if your documentation were to say, let me think of something. The patient had an abnormal cerebrospinal fluid that had odd cell. No, that wouldn't. Yeah, that's a good one. Okay, so abnormal cerebrospinal fluid. So you go to abnormal, and then under abnormal, you go to cerebrospinal fluid, and then maybe it was an abnormal drug level in the cerebrospinal fluid, or an abnormal hormone level in the cerebrospinal fluid, or an abnormal microbiology, maybe something grew out in your cerebrospinal fluid. So that's kind of how you use those. Okay, so we have the index. We'll do a little bit of drilling later. That just kind of barely gets your feet wet, not really. So your real index goes to Z, just like normal. Goes to Z. And remember, you always go to your index first and then you verify. Then right after your index, you have something called the Neoplasm Table. This is where all of your tumors, cancers, benign and malignant, secondary malignants, cancer in situs, unspecified behaviors, all of that's in here. And they're all put into a table for us. So I do label this because I don't want to have to be fishing through all of these index pages when I actually want to get to here. So I do label it. You will find yourself, depending on what you code for. If you're coding just for the CPC board at this point, you're still going to have to get into, fairly rapidly be able to get into here. Okay, so let's look at this table a little bit. Neoplasm meaning new growth. So you can have new growth that is malignant, which is cancer, or you can have new growth, which is benign. Sometimes benign stuff causes as many problems as the malignant stuff, but once it's out, you just don't have the ongoing risk of those cancer cells still being there. So again, we have a lot of indentations. So your neoplasms begin with the abdomen, so they're all going to be alphabetized. And then up underneath your body areas or your alphabetized word would be any specific. So if you look over here at the bladder, if you look under Neoplasm Table, bladder, you can see all the different parts of your bladder that you might have a tumor or cancer. So let's say the doctor tells you that or documents the patient has primary bladder cancer, doesn't give you anything else, primary bladder cancer. You're going to go to Neoplasm, bladder, over under primary. He didn't tell you specifically where it is. So the code would be C679. So now let's say that same doc documented bladder neck, primary bladder neck cancer. So then you would go to your Neoplasm bladder to the neck, and it's C67.5. So you see it's just a touch different. It's a more specified code. Let's say the patient has bone cancer of the heel or the calcaneus. So we go to neoplasms, bone, calcaneus, C40.3. The dash means you've got to go verify it for something more. So let's look here. Let's go to that. So we have bone, calcaneus, C40.3. So let's go verify that. Let's get back in here. All of your tabular, if you can see, we'll start with A and it goes through the alphabet. So we want to go to C. It's kind of color coded. It's C40. You should have your codes along here that you can, once you get used to the book, it's really easy navigating. Okay, so let's see. C, whoops, just ripped my whoop-de-doo. C40, whoops, and there'll be a glare, of course. C40.3. So this is malignant neoplasm of short bones of lower limb. So we had calcaneus. So the index or the neoplasm table told us to go here. So the calcaneus would be short bones of the lower limb. It did say 40.3, right? I'm not just making it up. Okay, it's been a long day. And let's say it's the right leg. So you have a choice of 3-0 unspecified, 3-1 right, 3-2 left. Of note, generally the number 1 is going to be a right and the number 2 is going to be a left. If that helps you any. That's usually how it's just something fun to remember. So now we've verified it. I'll get to that in a minute. So now we've verified it. So that's kind of how the neoplasm would work. You would come here. Let's do another one. Let me just open. Let's do secondary neoplasm of the frontal lobe. How about that? Secondary neoplasm or secondary malignancy of the frontal lobe. So let's go to frontal, and we can do lobe, which this is brain, the frontal lobe of the brain. Secondary would be C79.31. C79.31. So we would want to go and verify that. C79.31. C79.31. So this is secondary malignant neoplasm of the brain. So that would be correct, because so that's telling you they don't specifically have a frontal lobe when you get to verify, but you know the frontal lobe's part of the brain. Okay, so let's go back to the very front page of your neoplasm, just because this is a handy little thing to know. So if you look, neoplasm here is bold, and then it goes across. And neoplasm, neoplastic, doesn't give you any specific part of the body. Nothing is specific. This means these are either unknowns or unspecified. So you don't even have a body area. Maybe the doctor said patient has primary malignancy that we're treating. That's all they say, primary malignancy. So you would go to neoplasm, malignant primary is C80.1. So when you go to verify that, let's see what it says, C80.1. It's going to tell us that it's an unknown. So C80.1, malignant primary neoplasm, unspecified. This is cancer, and NOS means not otherwise specified. This is cancer, unspecified primary. Carcinoma, unspecified site primary. Malignancy, unspecified site primary. So that means the documentation that you have gave you just enough to know that the patient has a primary cancer, but you have no idea where it is. And so that would be true for all of these. So if there's a primary unknown, secondary unknown, cancer in situ, what that means in situ means it's a cancer, but it stayed where it originally was. It has not spread anywhere. Benign tumors, or a benign neoplasm, benign new growth. An uncertain behavior. Uncertain behavior means the pathologist has looked at it and cannot determine if it's malignant or benign, which means it's probably it's a very cautious situation. Because if the pathologist cannot determine the behavior of the cells or the tissue they're looking at, you're probably going to need some treatment. Have it cut out or something, because it could very easily turn into cancer. Unspecified behavior, same kind of way. Here we have a potential neoplasm that we don't know what the behavior is. Behavior as in, is it going to turn into cancer? Is it going to stay benign? Okay? You see uncertain some. You generally don't see the unspecified that much, especially in outpatient. Okay, so that is the neoplasm table. Now we have our next table. This is the table of drugs and chemicals, and these are drugs and chemicals that either poison you accidentally, unintentionally, poison you by self-harm or someone's trying to kill you, poisoning by assault, that could be putting a roofie in a drink, that's considered assault at a bar, poisoning undetermined, adverse effect of the drug, and underdosing of the drug. If you take so let's talk about these a little bit. Let's get to a drug that we know about. Let's go to, take your drug table and go to acetaminophen. That's Tylenol. Acetaminophen. I gotta spell it right. It always takes me a minute to. I know I sound crazy. There it is. Acetaminophen. So if the patient was accidentally poisoned, maybe it's a kid that accidentally took a whole bottle of pills and they got to pump their stomach, then it would be T39.1x1. If it was an intentional, maybe someone's tried to kill themselves with Tylenol, it would be T39.1x2. If it's poisoning by assault, that means someone either forced them to, snuck it in their food, something. They're trying to kill them. Or the patient took it, someone intentionally gave it to the patient without the patient knowing. Maybe that's nicer. T39.1x3, poisoning undetermined, T39.1x4, and then so on. Your adverse effect, we'll talk about that in a little bit, and your underdosing, we'll talk about that in a little bit. There's some guidelines for those. But that is, so you would go to the drug, let's say diphenhydramine, that's Benadryl. Diphenhydramine, and I have to go really slow to get all this. Sorry, I gotta go slow. Diphenhydramine. So there, that's T45.0x1 for the poisoning accidental. Let's say that maybe, how do I want to do this? Let's say that someone intentionally took the whole bottle of Benadryl for whatever reason. Clearly it was a self-harm. So it would be T45.0x2. You still verify off of the neoplasm and off of the drug table, but these you're probably not going to find too many times that you have to go different from what's on here. Anytime if you're on one of these tables like we had in the neoplasm, if you're on one of the neoplasm codes and they have a dash, if it ends in a dash, like under, let me find it on the first page because it's so hard to, like abdomen, the very first one, abdomen under secondary has C79.8 dash. That means you have to have another character. That's not a valid code right now. You have to go look it up and verify it. I would absolutely make a habit of verifying everything all the time anyway. I always do that. I never code straight out of the index. I never code straight out of a table. Now, there are times that I code memorized codes. And they tell you not to do that, but there are just some codes you use so much you have them memorized. Okay, the next table is an external cause table for injuries. This is used only when someone has an injury. They have a fracture. And it's usually only used during those initial treatments. So patient comes to the emergency room with a broken arm. They fell out of a tree. You would find they fell out of a tree in here, and that would be the reason for the broken arm. Patient was in a plane crash and broke their neck. Injury due to a plane crash. This is where you would get that Y code or Z code or W code, V code, and then you would code the broken neck. Okay, so that's what these are. You'll have just to remind everybody, I'm still in the 321 coded book. This is your ICD-10 starts in your chapter 2 is an introduction. Please know that these PCS codes, that's procedural coding system, that is for inpatient procedures, not outpatient procedures. Please, for the purpose of the AAPC board, you will not have any ICD-10 PCS. That is only for inpatient coding. So ignore any of that in here unless you're studying for the PCS. Or studying for maybe the CCS and you need to learn the PCS. Okay, so what have we figured out so far? So we know that we have guidelines. We know that we have symbols. We know that we have anatomical pictures. We know that this whole book is based on looking stuff up in our index. We always go here first. We know we have a cancer or a neoplasm table. That's where we get our cancer codes. We know we have a table of drugs and chemicals that could potentially have caused us harm. And we have an external cause index for if we have injuries or if someone is injured, we go here for the cause of that. Something externally, I mean, if you break your ankle falling off a curb, the curb you fell, that's how you broke your ankle. So it's an injury. So it's an external cause because you fell. Okay, so now we're in the tabular side. Sorry about the dog barking. We got, this is COVID-19. We've got kids playing outside, getting all that wonderful air. And I know they're tired of being cooped up, but my little poodle doesn't like it. Okay, so we have multiple chapters. Chapter 1 are your codes A00 to B99. I went on and tabbed all of my chapters and my codes in here. You can take the time to do it or not. If you can see all the different colors, every change of color is a different section or a different part of the tabular that you're coding from. So it's whatever's best for you. I would probably recommend, if I were working only by myself, like this is my work one because I do risk adjustment. So we're always working a year behind. I have nothing tabbed because there's once you're familiar, you don't have to have it. But for the purpose of learning the book, getting familiar with the book, taking your AAPC board, I would very much recommend go on and tabbing it. If for nothing else, simply walking through, taking the hour literally that it takes to tab it, gets you familiar with your book. And there again, the more familiar you are with your book and your manuals, the better you will eventually be. Okay, so chapter 1 is your infectious and parasitic diseases. So this is where your cholera is going to be. Your AIDS is in here. Your tuberculosis. Any kind of parasite or infectious process. Scarlet fever's in here. Leprosy's in here. Okay, that kind of stuff is in here. And again, I'm just kind of walking through the book so we are kind of familiar so that when we close this book up in a few minutes, we have a little bit better understanding of what the whole book is as a whole. Then we can start breaking down parts of it. Okay, your chapter 2 is where your neoplasms are. So when we were doing the neoplasms, looking at the neoplasms from the Neoplasm Table, this is the chapter that we were coming back to verify. So this is where all of your neoplasms are. Look at that. I've never been on that page, but look, that's from the publisher. That's kind of crappy, isn't it? Just on that one page. Must have been something with your printer. Oh, cool. Okay, so all of your malignant neoplasms are in here. Squamous cell carcinoma, Kaposi sarcoma, malignant nipples, your private part, male and female stuff's in here, your Hodgkin's lymphoma, non-Hodgkin's lymphoma, all of your leukemias, any kind, whether it's a solid cancer, a blood or liquid cancer, it's all in this section. Chapter 3, diseases of the blood-forming organs, and diseases involving immune mechanism. So these are your anemias are going to be in here. All kinds of anemias, aplastic anemia, anemias from chemotherapy, coagulation defects, hemophilia, when you're bleeding too much, diseases that you clot too much, diseases that you bleed too much. Okay, that's all in here. Chapter 4 is your endocrine, nutritional, and metabolic diseases. This is where you're going to find, and there is good information in the front of these. Would probably be very smart, especially if you're new to coding or new to medical terminology. This would be a great place to maybe even write notes. We do have good note pages in here too. So in here is going to be thyroid issues, any type parathyroid issues, underlying conditions, diabetes, whether it's type 1 diabetes, type 2 diabetes, drug-induced diabetes, whatever it is, it's going to be in here. Secondary diabetes, because maybe you've got pancreas issues. Okay. Adrenal issues, any kind of endocrine, which is hormonal stuff, hypoparathyroid, hyperparathyroid, pineal gland dysfunction, thymus issues, nutritional issues, metabolism issues. That's the kind of stuff that's in here. Chapter 5 is the mental health, behavioral health, and neurodevelopmental. So this is where your depressions are going to be, vascular dimensions, all of your dependence codes, whether it's alcohol, opioid, marijuana, whatever you're hooked on at the time is going to be in here. Sedatives, because you can have some pretty strong addictions to that. Cocaine abuse, any kind of drug abuse is in here. Then it gets directly into sorry, I was reading that. Nicotine dependence, inhalant dependence. The inhalant, I think, is where you get your vaping now. You know, we got to include that. Then we get into the psychoactive substances, which then gets us into the actual mental health, the schizophrenia, bipolar, depression, all of those. Any conversion disorder, dissociative disorder, all of those. That's all what's in here. Just a high level. Chapter 6 is your nervous system. Again, great information here. Meningitis, bacterial meningitis, which the meninges, that's why you would be in the nervous system, opposed to meningitis being in your bacterial. And infections, the first chapter. ALS is in here, MS is in here, epilepsy's in here, pretty much anything that affects the brain or the spinal cord is going to be in here. Migraines are in here. Then we get into the eye, anything with the eye, glaucoma, lazy eyes, cross eyes, all different kinds of, if you have problems with your tear ducts, conjunctivitis, that's problems with that outer layer that goes across your eye. That's all of your eye stuff. And then your eyes go right, look at that, that's another stain. Oh my gosh, you guys are my witness. There's some of these pages I haven't even been on. Chapter 8 is your ear. So see, it kind of flows to some extent. You're kind of familiar with the chunks of information because that's how the CPT is. So you have your external stuff, otitis externa. Then you have some of your otitis media, which is that middle ear issues. So this is diseases of the middle ear. Diseases of the middle ear and mastoid. Just different. You guys can just kind of, and then inner ear issues, you can go through it just like I am. I'm just trying to thumb us through so that we have a good idea of what's in this book. Chapter 9, circulatory issues. Really good information here to kind of learn some of the arteries, veins, issues with them, common pathologies of the circulatory system. Hypertension is one of them. It causes increased pressure. Really good information in here to help study. Rheumatic fever. Acute MIs are in here. Circulatory. Remember, anything has circulating blood. Well, the heart's one of the major reasons we have circulating blood is because the heart beats. So anything cardiac is going to be in here. Subacute MIs, clots in the heart, hypertension, pulmonary hypertension, pericarditis, so any infections of the heart, cardiac arrest is in here, arrhythmias, cardiac arrhythmias are in here. Then it goes into cerebrovascular disease. This is more potentially stroke types of things, whether it's cerebral infarction from a stroke, whatever the reason for a stroke, all of that's in here. Then we have a sequela. We'll talk about sequela in a little bit. Then it evolves into atherosclerosis of the extremities and peripheral vascular disease, which affects the extremities. I asked that on my interviews. So if you guys want to pass any interviews with me, no, peripheral vascular disease affects most commonly the lower legs or the legs. That would be very good. Different issues with arteries, veins, embolisms, thrombosis. Okay, then we get into the respiratory. So this is all your pulmonary stuff. Laryngitis, upper respiratory infections, lower respiratory infections, asthma, COPD, emphysema, bronchitis, chronic bronchitis, acute bronchitis, about any combination you can come up with. Acute respiratory distress, probably in here will end up being COVID-19. It's probably, I can't remember, it seems like it was maybe a J10 that they're talking about. You guys may. I don't read those emails. Maybe as close as I should. J10, no, that's under influenza and other identified. Nah, I don't think it's J10. I think I maybe just lied to you guys because that's all influenza. I don't know. Anyway, COVID is coming in here somewhere. You can Google it. They've already been putting stuff out. I just didn't pay any attention because for me, I don't code real time. I always code behind. So it's not affecting me this year. It'll affect me next year. Pleural effusions, other respiratory disorders, that's all your lung stuff. Then we get into digestive stuff. This could be your GERD. It could be as simple as dental cavities or caries, what they call them. Loss of teeth because of periodontal disease, could be esophagitis, could be GERD again, I already said GERD, acute gastritis, diverticulitis is in here, hernias are in here, ulcerative colitis of every part of the body or every part of the colon is in here, Crohn's is in here. With a lot of these, and as you hone your skills, you'll know, but Crohn's disease can affect multiple parts or only one part of the small intestines or large intestines or both. Same thing with ulcerative colitis. It could affect part or all of the colon. So you need to, ICD-10 was designed to get as specific as you can. So you have to try the best that you can based on the documentation that you have, which is sometimes not great, but sometimes really good to plug in the most specific code that you can come up with. Ulcers, anal polyps, rectal polyps, toxic liver issues, hepatic, fibrosis, just all kinds of stuff. Anything gastric's in there. Then we get to our skin. I will have to say this graph, probably 12, 13 years ago, helped me in one of my tests, and it still helps me. I think that is really, I can't tell you how many times I come back to that, believe it or not. As strange as that sounds, I do. There are just some things that don't set with me, and the pictures just really help me. Okay, so this is all skin and sub-Q. The sub-Q, remember, is the fat. So this is going to be your cellulitis, which is skin infections, your dermatitis, allergic dermatitis, redness, erythema, allergic itching, urticaria, itching, idiopathic itching, Seborrheic keratosis, pressure ulcers, very, very common with our diabetic patients, although they would be considered non-pressure. Pressure ulcers are generally in the older population who are not turned like they should or sit for long periods of time. So you would have to find the specific body part. Non-pressure ulcers, these would be the section that you would probably link to your diabetes. Okay, next chapter. Believe it or not, we're getting close to being out of this. Your musculoskeletal chapter, again, has really good information in front of it. Talks about the different joints, synovitis, and that kind of stuff. So the has your infectious arthropathies. So let's talk about that word. Arthro meaning joint, pathy or pathies meaning disease process of. So this is an infectious disease process of the joints. So here again, I've said it probably on every video. You're probably tired of me saying it. If you know your prefixes and suffixes, then even if you don't know what a word means, you can break it down to get an educated guess. I cannot stress that more. Okay, so this is different arthritises that you would have. Rheumatoid arthritis here, Felty syndrome, all kinds of stuff. Clubfoot, hallux valgus, which is your bunions. Anything to do with musculoskeletal, so muscles and bones. That's what all of this is. Myositis, inflammation of the muscle, could be anywhere, so you have to find your specific body parts. Rupture of tendons is in here, just all kinds of stuff. Then we get to the genitourinary. Again, you have lots of good pictures. Genitourinary as in, like this is glomerular disease, so this is of the actual kidney, a specific area within the kidney. Renotubulo, interstitial diseases. So again, this is still with very high, still within the kidneys. Then we're coming down into the ureters some, so you kind of remember your anatomy. Cystitis, so interstitial cystitis, that's going to be inflammation interstitially within the walls of the bladder. You've got male organs. All of these previous to the male were kind of generic. That could be a male or a female could have them. Then you get into stuff that is specific just to the males. And then you get stuff that is specific just to the females. Within the males and the females here, they have down here, and we'll talk about these symbols in just a minute, but you'll see that they will have specific, if you look over, and I am on your page isn't going to help you, 875, but I'm on the page that has code N70, if you find that, N70. If you look along the side here, you will see the symbol for female. And what that means is this code can only be for a female. So if you try to put this code, any code that is female only, if you try to put that on a chart claim for a male and send it through your clearinghouse, it's going to get denied just because it's the wrong sex. Same thing for your male codes. You will see here along the side. There's symbols that they're just male. So there are also symbols that tell you an age range. So if you're trying to put a pediatric disease potentially on a 90-year-old person, that's not going to go either. Okay, then we have a section just for pregnancy, childbirth, and puerperium. This is probably my least favorite section because I'm not a fan of coding pregnancies. Some people love it. That's great. I'm glad there are people out there that like it. I just don't happen to. You can easily come up with 10 codes for a problem delivery. But every complication you can think of for the mother or the baby or pregnancy in general is going to be in here. Within your pregnancy codes, you have to, and here I'm under code 033.3, 033.3. Within here, this is just a great example. You have to keep track if there's multiple fetuses, if there's twins, triplets, quadruplets, you have to keep track of all of them. Yeah, it gets crazy really fast. So Fertility Doctor is not who I would work for. Well, fertility maybe, but not for the OBGYN that specializes in the high-risk pregnancies. That's a no bueno. Still all kinds of issues. Infections during pregnancy, problems during delivery, pre-existing problems in the mom that exacerbated during pregnancy. There's just 100 million things that are in there, but that's what that section is. Chapter 16, certain conditions originating in perinatal. So, whereas your O codes were for the pregnancy, never put an O code, which is the mom, on a chart of the babies. Your P codes are babies. O codes are mamas. Know that. And we'll talk about that again when I go over guidelines. But that's another very easy way that something will get denied. Your chapter 16 for your perinatal, these are baby codes. Baby, newborn codes. O codes are the mom chart. P codes are the baby charts. So these are all kinds of problems, diagnoses that would affect a newborn if they were not, healthy. All kinds of problems. Maybe they were just born dehydrated. Maybe they were born full of fluid. Who knows? Chapter 17 are congenital malformations, deformations, and chromosomal abnormalities. So deformed type of scenarios. Down syndrome would be in here. Chromosomal issues are in here. Anything congenital. There are some codes in here that can, like especially congenital malformations, that may follow the person for life. Some things in here would not. They would end up growing out of or potentially having fixed, maybe something that's deformed, a finger's deformed or a hand's deformed and they have it fixed. Okay, so these are all your congenital types of things. Chapter 18, just like CPT had a medicine section, that was a catch-all. This is a little bit of the ICD-10 version of a catch-all. This is your symptoms, your signs, your abnormal stuff that the doctor really doesn't have a definitive diagnosis yet, so they're going to code the symptoms. So maybe a patient has a high fever, but they don't know that it's pneumonia yet. So they code fever of unknown origin. So that would be in here. Maybe the patient has bradycardia right here, just a slow heart rate. And that's what's coded until the doctor diagnoses tachybrady syndrome and puts in a pacemaker. Stuff like that. Abnormal blood pressure reading without diagnosis. So you go to the doctor's office and you have elevated blood pressure. Well, I think kind of the rule of thumb, you have to go to 3 visits and have it elevated all 3 times, and then the doc will diagnose you with hypertension. I'm sure that is subjective and varies from doctor to doctor. My doctor actually did. He does the 3 times. So an R03.0 might be your elevated blood pressure diagnosis until you get diagnosed with hypertension, which is I10. So that kind of stuff. Your vomiting's in here, coma scale's in here, which is, really a little bit more involved. Urethral discharge. If that's your problem, that may be your diagnosis until they tell you have gonorrhea. Whatever it is. I know that's kind of strange that I just came up with that, but I just happened to see it. Finding of unspecified substance not normally in the blood. Just really generic stuff in here. That's why most of the time your symptoms aren't going to hold water on a claim. That's fine to start with the symptoms, but the doctor really does eventually need to find out what's wrong with you. And then you drop all these symptoms and you code just what the definitive diagnosis is. We'll talk about, in guidelines, we'll talk about when you drop the symptoms, when you don't, that kind of thing. Chapter 19, your injury, poisonings, and other external cause issues. Most of these codes, you will also use an external cause code, injury code, to explain why. So the patient comes in with a contusion of the eyelid or has a black eye. It may be because he was at a bar last night and got in a fight. So then your external cause, so this would be the reason they came in, contusion of the eye. But you would also add codes, patient in a public bar and struck by another person, assault or whatever, whatever it is, whatever the specifics would be to it. Penetrating wounds, injury, getting cut, all your lacerations are in here, your broken bones are in here, your dislocations are in here, all of your lacerations are in here, sprains are in here, punctures are in here. I'm trying to think of anything. If something external, even if it's a tree branch, caused injury to you, this is probably where we're going to get that code. Traumatic amputations. Maybe you were working on your lawnmower with it going, which is not smart, and you cut a finger off, or you fell, you tripped with the weed eater and got your fingertip cut off. The accidents happen, crush injuries, all kinds of injuries in here. But that's what this section is. It is a huge section. I'm telling you now, huge section. I personally, they ended up putting all of it together into one. And so if you find your body part, you can kind of find all the injuries with the body part. Someone seemed to think that was the good way to do it. I prefer the other way of doing it. ICD-9 way, it was just easier for me to find stuff. But if you are truly going to the index to find these codes, then it's doesn't make any difference. Your next little section which is still in this chapter 19, but this is where you have foreign body. You could have foreign body as in a thorn in your finger, or you could have foreign body as in you were in a tornado and a pole stuck, blew through you or blew into you or something. Foreign body in the stomach, maybe somebody swallowed a penny and there it is just sitting in the stomach making them sick, whatever it is. Your burns are in here. There's some specific guidelines on what to do with burns that we will go over. Usually takes several different codes to get to a burn or to accurately have a burn coded. After burns, you get all of your poisonings. So these poisonings, there again, meet up with your table of drugs. So that's kind of how they're fitting together. So yes, if you think that this book is a little redundant, it is, because what is listed in your index or these tables is also listed back here. So it is redundant that they're listed both places. But the design of this book is for you to find it in the index and then verify it back here. By verifying, I mean the doctor's documentation told you that the patient was poisoned, unintentionally poisoned by benzodiazepine or that drug class. So then you would find the drug, then come back here and it would tell you poisoning. Where did I find the accidental? Wherever it was. Poisoning accidental. Here it was. Poisoning by benzodiazepines, accidental unintentional. T42.4x1. Okay. Then we have our chapter 20. We're almost done. External causes for morbidity. This is where, or this starts a lot of your external codes from this. This is where you verify them. And then your Z codes. These used to be, if you know ICD-9, these were probably V codes in that world, but there's Z codes now. And these are the factors influencing health. So like if you're going to your doctor for your annual Medicare check, then your Z00, well, not for Medicare, for your annual wellness visit, let's do that. Then Z00.00, encounter for general adult medical examination without abnormal findings, or Z00.01 has abnormal findings. These would be, that was the reason you showed up, and those are the reasons that would be your first listed diagnosis code. And then if they checked your heart because you have coronary artery disease but it's stable, then they would add that and all of that. Your Z23, if you go to that, Z23 is your code for immunizations, encounter for immunizations. So if your kid is going for their 2-month, 4-month, 6-month, 5-year, 15-year, whatever immunizations, Z23, and that's the reason why you've shown up is for immunizations. Z23 is probably going to be the first listed. That's the reason that they're there. This Z23 is much improved from what it used to be. We used to have a V code for every different immunization you got. Now they've just lumped them all together and do the Z23, and then your CPT code is what tracks if it was for tetanus or diphtheria or pertussis, whatever it was. You have different Z codes, encounter for sterilization, encounter for pregnancy screening, antenatal screening, encounter for contraception. You have your prosthesis. So you have an artificial arm. So this could be an encounter for fitting and adjustment of an artificial arm. Lots of different, just across the board, weird stuff in here. Your personal histories of, maybe you have a personal history of smoking, personal history of stroke, personal history of breast cancer. That's going to be in here. BMI, all the docs want to track BMIs on all of us now, sadly. So all your BMIs are in here. There's Z codes. Personal screening for stuff, high risk counseling, just all kinds of stuff. So you're not sick, but you're still encountering medical. You know, I want to go in because I need to have, what do I need to have? I have a personal history of cervical dysplasia, and it's time for my pap smear. So I may not have it anymore, but that's my personal history of it. You know, I mean, it plays a role. Maybe I have a colostomy. Maybe I have a trach. So there's maybe I have an artificial eye, presence of an artificial eye. There's just a million jillion ways to track stuff in here. Now, I'm going to throw this in case there's any risk adjustment people out there, because we're kind of coming up on the risk adjustment time. I will do some videos for risk adjustment too, or to get your CRC. This appendix back here, Appendix A, is really, really good in my opinion. If you're working a risk adjustment project that's a quote code all project, if they talk about code all, this is a fabulous cheat to get to all of those long-term meds that folks are on that you have to track. I'm just throwing it out there. I found it to be extremely useful one year. Okay, so now, I know that was a long video, wasn't it? Let me go on and stop now with this video from this overview. I'll stop it and we'll start again. And the next video, I'm going to go through the symbols, the guidelines, and how to read the codes. All the different notes that you have, the includes, the excludes, and all of that. Okay? I think it's just too long to keep going. So Next video, we'll get into the nitty-gritty on how to read the manual.